Today's episode is brought to you by Mazars.
Sound Cartel.
Preventing COVID transmission should continue to be a priority for business. It's good for your team's health, it's good for your customers' health, and it's good for your bottom line. From Sound Cartel, I'm Nicole Goodman, and this is Business Essentials Daily. It's well worth taking a risk assessment in your workplace. That may include continuing to wear face masks, depending, of course, on the circumstances of your business. So says Dr Catherine Kelaher, Medical Advisor at the Office of Health Protection at the Commonwealth Department of Health. On the 8th of March, Dr Kelaher will join two other panellists in a one-off live online discussion called COVID Merry-Go-Round, Searching for the Business Wins. Brought to you by the Business Essentials Daily podcast and Barrington Centre, the free webinar will feature Dr Kelaher alongside John Di Natale, acclaimed business coach, mentor and author, and Rhonda Andrews, leading corporate psychologist and managing director of Barrington Centre. Plus, economist Professor Neville Norman of Melbourne University, who will address the state of the economy and the implications for business. A link to the details of the event and to register are in the show notes of this episode. For a taste of what the webinar will showcase, Chris Ashmore asks Dr Kelaher what businesses need to think about in terms of health.
The first thing is to manage your risk with relation to COVID. Obviously, that means protecting people who are coming to your businesses, and it also means protecting your staff. So I would think ensuring that you've undertaken appropriate risk assessment, that you've protected your staff as much as possible. Health obviously is encouraging primary course of vaccination to protect people from severe illness. We're obviously encouraging people to access a booster when they're eligible. And it's also helpful to have awareness of particular issues that might put people at risk.
Well, from a health perspective, any suggestions for business as we continue working and living with COVID?
Yeah, thank you, Chris. So it's really important at this particular time because it's really a time of transition. There has been a lot of uncertainty and change over the last few years, but at this point we are transitioning with public health measures rolling back in a lot of states, particularly on the eastern side of Australia, and we're transitioning between that point where public health is dictating the roles and the mitigations businesses should put in place. And we're moving to a place where businesses will need to take more responsibility. So I would suggest businesses undertake a risk assessment with specific relation to COVID and find out for themselves in their situation what mitigations they need to apply. And they might be less than what they're currently using, but it might be more than the public health requirements, depending upon where they are, what they do, and what their risks are.
And speaking of risks, what are the risks for business with COVID?
Well, obviously the health risks, and I'm speaking from a health perspective. So what we would like to see is people protecting their workforce and themselves from bringing COVID into their workplace, preventing transmission of COVID in their workplace, and putting controls in place in order to prevent those issues from occurring. And, that's obviously the major risk at this point in time.
Well, on a practical level and, trying to mitigate those risks of passing on COVID, if we look at, say, face masks, for example, is it a good idea to keep wearing them in the office?
Well, again, Chris, that really relates to the risk management plan, and I'm an occupational physician, and so my focus is all about workplaces. And my first advice, as I've mentioned, is undertake a risk assessment in your workplace. Apply a risk management approach, which means applying a hierarchy of controls, means looking at the highest level of control. How can you eliminate risk in the workplace? What can you do to reduce the risk? What engineering measures can you do to reduce the risk, and administrative measures to reduce the risk? PPE is considered the lowest lowest level of control, but there are some situations where that may be required, i.e. somebody who's a customer service front person and has lots of exposures during the day. I mean, outside of the public health requirements, the businesses have a responsibility under the Work Health and Safety Act to undertake their own risk assessments. So when public health requirements for masking go away, then businesses will have a requirement to assess their risk and determine if PPE or other controls are required in the workplace.
Well, some businesses, and particularly those with office workers, have adopted some kind of hybrid model of going to work. So a rotation of workers working a couple of days a week and then working at home. What are your thoughts on that?
Yeah, look, Chris, that's a mitigation, like an administrative control that businesses use to reduce the risk of interactions. And that has the on-flow risk of reducing potentially transmission in the workplace. And that will work for some businesses and it may not work for other businesses depending upon the business model. So again, it does relate to the specific business. And if that as a control works in a sustainable way for a business, they could continue that until their risk assessment indicates that they can return to a more normal model. But I do note a lot of businesses are changing their models, and that's worth considering going forward as well.
Well, final question. COVID's been with us for a long time and we don't really know the end game, but in terms of long-term impacts that it's having on the well-being and health of people in the community, what do you think they are?
They're multitudinous, Chris, and where the research is showing us more and more impact. So firstly, obviously, there's the acute illnesses that we're seeing. In essential services, we're seeing burnout, psychological stress and exhaustion, particularly amongst our healthcare workers. Those are more immediate effects. From a healthcare perspective, there are people who haven't been able to access, diagnostic services, or they've had diagnosis delayed or treatment delayed. Those are important. We're likely to see impacts related to long COVID, and information around the impact of that and also the management of that is still emerging. There was a recent study in Nature indicating people who have had a COVID infection and just being infected has increased risk of cardiovascular disease. So there are a lot of things emerging, and we're going to need to watch this space ultimately to work out the effects. But I think there will be effects for, the medium to long term that will continue to roll out over time.
That was Dr Catherine Kelaher, Principal Medical Advisor at the Office of Health Protection at the Commonwealth Department of Health. Please join Dr Kelaher and the stellar group of panellists at 7:30am on Tuesday, 8th of March, for the live webinar. It's a free event and we'd love to see you there. You'll find all the details in the show notes of this episode. This episode of Business Essentials Daily is produced by the team at Sound Cartel. Thanks for listening. I'm Nicole Goodman. We'll bring you more Be Daily tomorrow. Follow at BE Daily Podcast across social media and head to bedaily.com.au for more from the Business Essentials Daily podcast.
Sound Cartel.
This episode was brought to you by Mazars. To find out more, visit mazars.com.au. That's mazars.com.au.